Hi, I am Beulah Ullum, and I am going to be demonstrating an IV medication administration. That's what I'm trying to say. So I'm going to knock on the patient's door, introduce myself, confirm patient's name and date of birth before getting started, take baseline vitals before administering the medication, and then inform the patient that they have a Lasix administration ordered, explain what that does, like for their specific medical need, and then also any symptoms that they may need to know about or let us know about. And then wash my hands, put on my gloves, maybe. They're so hard to put on always. My hands get sweaty. Oh my gosh. These gloves are not gonna go on my hands. There we go. That's what I get for trying and making sure beforehand. Okay. Okay, after much effort, I have gloves. So then I would scan the patient's wristband and to bring up the MAR, and I would not touch that because that would contaminate my gloves. So I would scan that, make sure their name and date of birth match what's in the system, and then have the MAR there to confirm. So this patient's order is for Lasix for 20 milligrams, and then IV push, and the time for that is now. So I have confirmed all of that. Then I would scan my medication and make sure that the medication matches the MAR, and also check the expiration date to make sure that the medication is good. So all of those things are good. For this one, the Lasix comes in a concentration of 10 milligrams per milliliter. So for this patient, we would draw up 2 milliliters. So since this doesn't have a cap on it, I'm gonna wipe it off. I already have my needle assembled, so I'm going to wipe that off for 10 seconds. Okay, and let that dry. And while that dries, I'm going to uncap my needle, and I'm going to draw it up to the 2 milliliter marking. All right, to get that 20 milligrams. And then insert this, maybe. There we go. And then push that air and draw up that 2 milliliters. Just a little bit too much. All right, so show that that's at the 2. And then scoop that up until I'm ready for it. So that stays clean. All right, and then I am going to uncap this here and clean it. Again, 10 seconds. And then while this dries, I would assess the IV site, looking for any signs of infection, inflammation, or infiltration. So my IV site looks good. I'm going to first I'm going to have a flush here, a full-size flush. So I'm going to pop the cap, attach my flush in there, and then I'm going to unclamp this, and then I'm going to push just 2 milliliters to check the line. And then if I had a full arm, what I like to do is kind of gently palpate above the IV site, so I can feel and make sure that that fluid is going in where it's supposed to go. And then also ask the patient if they're feeling any pain or discomfort while that IV is or that fluid is going in. All right, then we're gonna disconnect this, and I'm gonna put this over here so I don't contaminate it. And then next, I'm gonna wipe this again. Nope, I missed it. There it goes. 10 seconds. And then I have my Lasix here. So I'm going to, now that this is dry, I'm going to connect that. And again, that's 2 milliliters to get the 20 milligram dose. And then we're going to push this really slowly over a full minute to minimize side effects for our patient. So about a 1/4 milliliter. We get 0.25 every 15 seconds. Okay, now that part is done. Disconnect that. And then we're gonna do one more clean before this last flush. And then since there is still some Lasix left in the line, we are going to push this initial part of the flush slowly like we did the medication to keep from overloading their system. Let that dry, and then reinsert the flush. And then again, we're just gonna do 2 or 3 milliliters, nice and slow to start with. Okay, and that's 2 milliliters flush in. And again, maintaining the integrity of the IV. Put this cap back on, clamp it down again. Ooh. All right, and now that we're done with that, I remove my gloves, perform hand hygiene again, and then reassess the patient. Make sure they don't have any ringing in their ears or feeling poorly. Reassess their vitals and make sure that everything's stable. And then complete any extra documentation that I would need to complete in the medical record. And then, again, hand hygiene again when I leave the patient's room. I think that's it.